Can you see the screen?
Yes, sir.
So let's start. We are discussing ECG. In the last class, we just saw the functionalities of the heart, mainly functionality of the heart. Okay. Any question from the last class?
No, sir.
Okay, so let me discuss this a little bit more. Just to. So in the last class, we discussed the functionality of the heart, the basic functionality. Today, we are going to see a little bit more detail into ECG and how it's related to heart functionality. Achha. Now, what do we have here? We have atria. We have total 2 atria, and we have total 2 ventricles. Okay. The purpose of the atria is to collect blood. Okay. They collect blood and they pump blood out. Okay. To the body. Okay. So there are in total, these are the 4 chambers of the heart. Okay. Summarize. So these are defined as left atria, left ventricle, right atria, right ventricle. Okay. And the serial goes like this. Right atria, 2 right ventricle, 2 lungs, from lungs to LA, to LV, to atria. So it is actually lungs, and this is actually aorta. So that is the process, the sequence, and these are initialized by electrical signal. These are initialized by some electrical signal. Okay, through some action potential, these things are generated as an electrical signal generated in the neural cells, the heart cells, generated in the heart cells. Gotcha. And in our ECG, we are recording this, the electrical activity. Okay, the ECG records this electrical activity. Gotcha. To summarize what actually happening, so first you have atrial contraction. Atrial contraction. Contraction means the pressure actually increases in the right atrium. Okay. So atrial contraction means the pressure increased. So when the pressure increased, the blood will pump from right atria, blood goes to right ventricle. So from right atria to right ventricle, the blood will flow. Okay. And in this section, this atrial contraction start through some signal. That is our P wave. Okay. And this actually happens in the SA node, in the sinoatrial node. This happens. And this is in the ECG, this is the P wave. Okay. The signal that starts this heart rhythm, starts this process. So from there, right ventricle to blood goes to right ventricle. And this takes some time, this period. Okay. The flow of blood from atria to ventricle, this takes some time. And this is actually shown in the PQ segment. Okay. This is shown in the ECG as the PQ segment. I'm going to mark these things. I will draw some figure a little bit later. You will see. So this is actually marked in the PQ segment, some time delay. Okay. Some delay, time delay that can be seen in the ECG. Okay. So from this right ventricle, am I audible clearly?
Yes, sir.
So from this right ventricle, it goes to lungs. In the lungs, the blood is purified. Okay. From the lungs, it now goes to left atria. Okay. Now from left atria, there is atrial contraction again. It contracts. And from the left atria, it goes to left ventricle. Okay. And left ventricle again contracts. From the left ventricle, it goes to aorta. And from the aorta to body. Now, among this whole process, why do you think we need the highest, the strongest pressure? কোন সেগমেন্টে সবচেয়ে বেশি প্রেসার লাগবে?
Initially,
Initially, why? Like this contraction, which contraction will insert the highest pressure in the chamber? Anyone? শোনা যায় না, কি জানি বলতেছো?
Left
Right.
ventricle.
হ্যাঁ,
Left ventricle.
লেফট ভেন্ট্রিকল, কাছাকাছি, নট হোয়াইট। আচ্ছা, দ্য হাইয়েস্ট প্রেসার উইল বি ইন দ্য, আচ্ছা লেফট ভেন্ট্রিকল, হ্যাঁ ঠিক আছে, আমি শুনছি রাইট ভেন্ট্রিকল। আচ্ছা, লেফট ভেন্ট্রিকল, দিস ইজ হোয়ার দ্য স্ট্রংগেস্ট প্রেসার উইল বি। Why? You see, from the left ventricle, now it is going to aorta. That means the pressure has to act against the pressure of the body, the normal pressure of the vascular system. Okay, so the strongest pressure because act against your like vascular pressure. So the left ventricle pressure has to be higher than that. So that is the highest pressure that you need. Okay, so to pump the blood out of the heart to the body. So that is when you need the highest pressure. But you see, this is, I'm talking about pressure. This is not electrical signal. Signal and pressure is different. The strongest pressure, you will not be able to see that in the ECG properly. It's not like that. So the electrical signal that we see in the electric signal that we see in the ECG that we are seeing, this actually precedes the pressure signal, the pressure. First, you have the electrical signal, and from the application of the electrical signal, these things happen, and then you have the result. Okay, so the electrical signal comes first, then the other things actually happen. So there is a small delay between the signal and what is happening in the others. Is it clear? Any question? Acha. So you see, there is other curves. ECG is not the only curve to measure the heart activity. There are other curves that is actually designed for instance, the pressure. There is, I think this is called Uyghur's diagram. Okay, that shows the pressure diagram. Okay. Now we are interested in the electrical part, not the pressure part. I will give you a link. You can actually view those things from that link. I think I also have this one. Let me show you. So if we see the ECG, it looks something like this. Not exactly, but something like this. Okay, so this is like a standard ECG wave. This is the P, this is the Q, this is the R, this is the S, this is the T. You did the lab, right? All of you did the lab? সবাই ল্যাব করছো ইসিজির? হ্যালো, am I audible?
yes, sir.
আচ্ছা, আমার নেট চলে গেছিল। আচ্ছা, কতদূর পর্যন্ত শুনছিলাম লাস্টে?
এই গ্রাফটা আঁকেছিলেন।
আচ্ছা, okay, how many of you did the ECG lab? সবাই করছো?
Yes, sir.
So did you get this kind of graphs in the lab?
Ji, sir, please. Yes, sir, we got it.
So it looks something like this. And these are the peaks. This is the P, Q, R, S, T. These are the 5 peaks. And we actually name this like this way. This portion to this portion. This is called the PR segment. PR segment. And then from the start of the P to C is the PR interval. Okay. And from here to up to this is called the QRS complex. Okay. Again, from here up to the end of T, this is the QT segment, QT interval. And from S to T, there is also a distance. Okay, before S, before T starts, this is called ST segment. This is important. We'll see about this one. These are important. Something we need for the analysis of ECG signal. So I think what else? PR interval, Q1 interval, PR segment, ST segment, QRS complex. Achha. Now we'll see how these things actually relates. Any question so far? Achha. Now see this cardiac rhythm, this kind of cardiac rhythm or cycle or cardiac rhythm. This is actually repeats. Okay, repeats continuously. Okay. And this is actually controlled by what? What control this process? Ki control করে?
The blood circulation.
It is controlled by pacemakers.
Oh, sorry.
Okay, the pacemakers actually control this rhythm, this hard cardiac rhythm. This is controlled by the pacemakers. Towards the end of today's class, we'll see some abnormalities in the ECG and what actually those abnormalities are. So you will see the pacemakers, if the pacemakers doesn't function well, some abnormalities occurs. Okay, and they can be dangerous for health. So this rhythm is controlled by the pacemakers. So the pacemakers are like, you have the SA node, that's the most important one, AV node, and they actually pass the signal. Okay, the stimuli that you have, it starts from the SA node, they actually propagates. This stimulus propagates from the SA node to the AV node, then to his bundle, then bundle branch, SA node থেকে AV node, his bundle, bundle branch, and then you have Purkinje fibers things. So when the cycle starts, it starts by stimulus, okay, in the SA node, and that stimulus actually passes, and as the stimulus passes, the different things actually, whatever the things I have written here, through this stimulus, all these things actually happen. So it starts from what is called the depolarization. This process is what we call depolarization. Okay, so that after the depolarization followed by a repolarization. So this whole thing, depolarization is for the electrical signal. Okay, so these things actually controlled by this kind of pacemaker, and the signal actually passes from one side of the heart to another side of the heart, and through these things. Achha. So we'll see some of the issues of this one a little bit later before I finish. And you see this rhythm has like a certain rhythm that is called resting BP. Okay. So the resting BP beats resting BP now. BP মানে blood pressure, BP না actually. The resting heart rate, HR. Okay. Cardiac rhythm, heart rate. The resting heart rate হচ্ছে 70 BPM. Okay. 70 beats per minute. BPM means beats per minute. Okay. That's the natural or normal heart rate. Okay. Now, if it is slower, like less than 60 BPM, so that actually refers to a condition. This is called bradycardia. This is one of the abnormalities of the heart that is called bradycardia. If it is faster than 100 BPM, That is the resting. Okay, these are things of resting heart rate. If you are exercising, your heart rate will always be faster. So that doesn't mean you have tachycardia. Okay, this is called tachycardia. It is the resting BP, your resting heart rate যদি 60 চাইতে কম হয়, then it is an issue, or if it is higher than 100, then it is an issue. Okay. So this actually relates to some other problems. We'll see a little bit later. Any questions so far? Any question? So this is the summarizing of the heart functionality and how everything is. Before going to the processing of the ECG, let's try to understand the different segments of ECG. Different segments of ECG. It starts with the P wave. Okay. And P wave was for atrial contraction. Okay. This is called the depolarization. Depolarization of atria. And as you can see, this kind of depolarization, they have low amplitude. So these have comparatively low amplitude. This is the P wave. And later when you see the signal processing, one of the things that we can do is to identify the amplitude of the different segments. Okay, through the different amplitude, we can actually identify which portion is the P segment, which is the R segment, which is the Q segment, things like this. Okay, so the P wave has a comparatively low amplitude, and it actually lasts for around 60 to 80 milliseconds. Now this time period and 0.1 to 0.2 millivolt, these things actually vary. It's not fixed. It varies from person to person, from especially person to person, from age to age. Like the time will be different for an old person compared to a young person. Also from male to female, that will also vary. So these things actually not 100% fixed, just a general consensus like this way. So after the P wave, there is a propagation delay. P wave পর there will be a propagation delay. Okay, and propagation delay at the atrioventricular node. And this is actually identified by the PR interval. Okay, or PQ segment, যেটাই বলো. So after the P, as you can see, after the P, before the Q starts, this is the drop of Q. This is the measure of P. So after the P is done, before the Q can start, there will be a delay. Okay. Now, this delay is important because if the delay is long, that means that is related to some abnormalities of the heart. Okay. If the delay is small, then also there is some problem. So that's why you have to understand every part of the ECG. So the PR interval and the PQ segment, they have a certain range. Like the PR interval is around 120 millisecond last for. The PQ segment is like 60 to 80 millisecond. Okay. So after P wave, you have a delay before Q. Before QRS. So after P wave, before QRS, there will be a delay. This is the propagation delay. And what happens during this propagation delay? কি হয়? সবাই আছে না ঘুমাই গেছে? হ্যাঁ, এই ডিলের সময় কি হয় একটু আগে বললাম। What happens? কারো মনে নাই? Blood flows from atria to ventricle. This is the time. Number 3, then you have the QRS complex. QRS complex, that is rapid contraction. So this one is slow. Okay, atrial contraction. This is actually slow contraction. because atria slowly contract, but when you have ventricles, you have to contract rapidly because from ventricle the blood will flow outside to the heart, okay, or the aorta, so you have to have rapid contraction. So that entire process inside the QRS complex, okay, and that's you see in the 1 milliframes, okay, it transfer around 80 milliseconds. Okay, this is the entire inside the QRS complex. You have the entire signal, the ventricular, left ventricular, right ventricular contraction, both of them are inside. Okay, after this process, you have a ST segment. Okay, that is the resting portion. Okay, after all these things is done, so this is your ST portion. Before the TF can generate, there is a delay. Okay, so this is another delay. This is when the heart rests for some minute and the blood actually blood passes from one side to another. Okay, so this is the ST segment and this is usually flat, the flat in the. And finally, you have the T wave. The T wave actually represents the repolarization of ventricle. This is also slow. The depolarization of the ventricle is the fastest one, and repolarization is also slow. And this lasts for 160 seconds, and a little bit larger. So 0.1 to 0.3 millivolt. So this is actually larger than T. It is usually larger than P wave. Okay. So this is different segments of the ECG. Okay, and you can actually record these things using your 12 channel ECG. How many channel did you use in your lab?
So 2 channels, sir.
Kata?
Duita.
Answer. Now, in a standard process, the standard process is actually 12 channel ECG that actually done in the ICU, things like that. So there are different one, number by 1, 2, 3, V1 to V6. So there are certain also like where to place these electrodes. There are certain rules also. You don't need this for the theory. So I am not discussing so far AVR, AVL, AVF. These are the 12. Okay. So depending on where you are placing these electrodes, it measures the difference, voltage difference. So some of the, like for instance, the V2, it actually shows the activity of the right side because it is close to that one. So different electrodes actually show different portions clearly. Okay, this is related to the placement of the ECG. ওটাও তো লাগবে না. Let's come to our main topic. So we want to understand how to process the signal. Okay, process ECG. So let me give you the common processing techniques first, then we'll discuss some other things. So to process ECG, okay, in general, what the technicians do, they do from this normal visualization plus experience. That what the technicians are actually do. So they have to have a long time of experience to understand the different issues from the ECG. So what we are interested in, as for this course, we are interested in the computer-aided diagnosis system, the CAD system. Okay. CAD means computer-aided diagnosis. Computer-aided diagnosis. So automatically identified by the computer that there is something wrong with it. So things like that. So for this kind of CAD system, they are more reliable because the technician can make a mistake. So in a CAD system, this is much more reliable. So if it finds, the CAD system finds some issues, it will give a signal or noise, some alarm to indicate the doctor that there is something wrong with the ECG of the patients. Now, when it comes to this kind of processing, there are different ways we can process the signals. The most common one is like a time domain analysis. What is time domain analysis? You measure the intervals. Between different parts. Alright. So you have the ECG. When you have the ECG, you measure the interval of different segments. Like from P to R, what is the time. So for instance, here we see, if you have the ECG collected, you can measure the interval from the PR segment or the ST segment or the PR interval, QT interval, things like that in the time domain. So this is the time. So in the time domain, you can measure this portion, and those actually relate to certain medical conditions. If there are some issues you can identify, we'll see next what can be the defined issues that can be identified from this time domain analysis. So in this part, when you have the ECG signal, you measure the time domain. So if you have a MATLAB, in the MATLAB, if you have the signal, you can easily measure. So in the MATLAB, you can easily measure from. Have you ever done peak analysis in MATLAB? করছিল কখনো? Anyone? Hi. হ্যাঁ?
না স্যার করি নাই স্যার।
আচ্ছা। So in peak analysis, you try to identify the peaks of the signal. Okay, so uh, so let me show you one. For instance, this is one signal. Okay, this is like a periodic signal, and you can see these are the peaks, and there is a there is a function in MATLAB that where you can actually find the peaks. So this is where the peaks are happening. So you can identify each peaks, and from this peak to this peak, you can identify the difference. The same concept you can also use for your PQRS, PQRST. Identify the peaks. The peaks are where you have highest value compared to the neighborhood peaks, neighborhood values. So this is a peak because it is higher than the neighborhood. Okay, that's how you actually identify the peaks. The same concept you can use in your PQRS segment. Another thing, okay. So, and this is your ECG signal. And if you look at this one, দেখা যাচ্ছে এই ছবিটা? Can you see
Yes, sir.
so this is like your electrocardiogram, okay, ECG, and this is not the only measure. Phonocardiogram is the sound. Okay, you can also see hear the sound, and you see the sound actually only here during this portion. Okay, the peak portion, that's where you hear the most amount of sound. So this is phonocardium, and this is the pressure. You see, when this peak is coming, that is the ventricle position. After this signal, this is the highest pressure you are actually getting. That this pressure is from the ventricular contraction. So this is the ventricular pressure, and this one, and this is the atrial pressure. You see the atrial pressure is comparatively much lower. And the ventricular pressure is very high compared to this one. The ventricular pressure is very high. And the volume pressure, when the pressure increases, the volume actually decreases. So that's why you have the opposite one. So these are different measures related to ECG, not just only one. Okay, let's go back. Can you see this screen? See this one? Acha. In peak analysis, you can identify different peaks in MATLAB. Then you can actually identify what is the distance between different peaks. Okay. So this is one way to measure the difference between different portions. Okay. And that will give you some information. Acha. So for instance, you can then compare with the standard value. For instance, when you have the ST segment, the PR segment, that should last for 120 millisecond or 60 to 80 millisecond. Based on that, if something is higher than that or lower than that, then you can say there is something wrong with the person's ECG. Okay, this is how you compare. So this is time domain analysis for your ECG signal. Okay, that is one. Number two, frequency domain analysis. In frequency domain analysis, so you see the heart rate. So the heart rate, the frequency of the heart rate, that is actually fixed. That should be around 70. If it is higher than that, if the frequency is higher of the beating or lower, that corresponds to some other issues. So in frequency domain analysis, you can actually identify these things. Okay. I'll discuss a little bit more in more detail a little bit later. Let me name all the main topics first. Then you have wavelet transform. Wavelet transform. This is one kind of signal transforming technique. Okay, I didn't cover this one. Take some time. It will take some time, but I didn't cover it. You can omit this one. The wavelet transform is like a modify the signal to get other information from the particular signal, different information regarding amplitude, frequency, all those different things. So, and this is important in mother versus fetus. Okay. That is a complicated scenario when you want to identify the ECG of the mother as well as the fetus, especially the fetus. That creates a problem because mother's ECG, the mother's actually heartbeat, that actually overshadowed the fetus's heartbeat. Okay, that creates a problem, and you have to distinguish between these two. In that time, in that cases, frequency domain analysis or wavelet transform becomes much more easier. You cannot do that based on time domain analysis. Okay, so I'll discuss a little bit more a little bit later. And other thing is signal processing, simple signal processing measure. Signal processing measures like, for instance, the peak analysis. I just mentioned, you can analyze the peaks. That is one thing. Also, the distortion. You can also measure whether your signal is distorted. Okay. For instance, this is your, this is better now. Sorry. It should be like this. Okay. So like this is your standard signal. And if you have another signal that looks like this, okay, so you can compare between these two signals and see how much distorted your signal is to the general signal, the normal signal. So that kind of distortion you can measure, and based on this distortion, you can actually come to a conclusion what kind of abnormalities there is present. Is it clear? Any questions so far?
No, sir.
Acha, no. So let me discuss a little bit about these things. So for instance, what you can do with these things, this kind of signal processing, let me give you some examples. First one, so for instance, you can measure the duration of heart cycle. Duration of heart cycle. Okay, so how do you measure duration of heart cycle? From 1 hour to next hour. Okay, so your ECG is like a continuous process. So it is like a continuous. Okay, you are continuously getting this one. Now, from this is like PQR. So this is like R. And this 1 hour to 1 hour, you can actually measure the distance. From 1 hour to 1 hour, this is like distance 1, distance 2, like distance 3. So you can measure this duration from different heart cycle. Now, in a normal scenario, in a normal patient, all of this should be almost closely equal. D1 equals to D2 equals to D3. These things should be almost equal. In certain cases, you will find that D1 equals to D2, but it is not equals to D3. That means two heartbeats are actually pumping same fashion, but the third heartbeat comes after a delay. So this kind of scenario actually results in some kind of abnormalities in the heart. Okay. We'll discuss a little bit later. So this is one process. You can actually measure the duration of the heart cycle, and from this one you can come to some conclusion. Okay. What are those conclusions? I will be discussing a little bit later. Also, number one. Number two, then duration, just I mentioned before, like the ST segment, then PR interval, okay, then the QRS complex. What is the duration of these things? Each one corresponds to a particular issue. If the QRS complex is broader, that responds to one issue. Okay, there are like 20 or 25 different abnormalities. So we'll see a few of them. Achha. Also, okay, duration of these things or separation. Duration, then separation. Separation from P to R. Okay, or S to T. So this is the interval, PR interval, ST interval. So these separations related to depolarization to repolarization. Okay, so these things, the depolarization, repolarization should come after certain delay. If there is no delay, you can identify those things from the separation from one segment to another. Okay, then you can say if the repolarization happening too fast, then that is a problem. Okay, Achha. So these things are related to the time domain analysis. We can actually do all these things from the time domain. Achha. In terms of frequency domain, so one of the issue of the frequency is, like I mentioned, we should too fast readout. Okay, so that is called fibrillation. There are different types of fibrillation. We'll discuss a little bit later. So one type of fibrillation is called atricular fibrillation. Okay, AF. So when the heart beats too fast, this kind of the fibrillation is one of the issue that can actually cause serious damage. So you can actually measure this kind of things from the frequency domain analysis. I already mentioned. Now, let's see one thing. So when you are measuring this kind of signals like the ECG, you are measuring ECG, but there are some issues. What can be the issue? During the measurement, did you stop your breathing? Did you stop breathing?
No, sir.
Of course not. ECG equipment, then other body functions. You see, when you're measuring these signals from the electrodes, other functionalities of the body is also there. The breathing is already there. Other body functions like muscle movement, things are already there, and they affect your ECG. Okay, how they affect, that is from the next class. We'll see. Today, I'm just giving you the basic signal processing idea of the ECG. So these things actually harm your ECG. Okay, adds noise to your ECG. So you have to filter those things out. You have to filter them out. Okay, so how do you filter them out? For instance, your breathing is actually regular. You're regularly breathing, but slow. Compared to your heartbeat, this is actually slower. So that kind of this kind of things you can easily distinguish. Since it is regular, you can easily distinguish it from the ECG. Distinguish, then subtract. So when you are examining the ECG, so that kind of like noise you can actually find. Regular noise from the breathing is coming. You just have to subtract this one. Since it is regular, you can easily find. Okay, that will be different than your ECG. So this is one. Another thing is, for instance, what হচ্ছে তোমার this equipment noise. Okay, noise from sources, noise from equipment. Okay. So for this one, you use a notch filter. What is a notch filter? What is a notch filter?
So reject particular frequency.
Reject particular frequency. So notch filter rejects a particular frequency. So to reject the noise filter, so notch filter, at which frequency we'll use? The power line frequency. Okay. So any noise that comes from the input signal, that's the power line frequency. So you use a notch filter at that one. So all the frequency related to that one will be removed. So these are like different signal, these are like different filtering techniques that you have to use to get your original signal out, much more pure signal. Okay. Achha, a little bit more. The last one. So there are different types of filtering techniques, and you are not just only using filter. You are using filtering. Also, you are using op-amp, okay, amplifier to amplify your signal. Okay, and when you do this amplification, noise is also amplified. So you have to use some other noise filtering techniques, other things to have your signal perfectly. Okay, so we'll talk about this one inshallah in the next class. Achha. Now, other thing that I mentioned a little bit earlier, achha, mother versus fetus. Now, this is an issue. This is an issue because they are usually very difficult to distinguish. Okay, difficult to distinguish. Okay, because the fetus, they are very closely placed. Okay, and what do? You place your electrodes, on the abdomen of your mother, of the mother abdomen. Now, the baby's fetus will be superimposed by the mothers. Okay. So fetuses heart rate superimposed by mothers. So how do you differentiate? So this is an issue. How do you differentiate mother and fetus's ECG? কিভাবে করব? Anyone? See, the fetus's heart rate is usually a little bit faster. This is usually a little bit slower. So the frequency, at the frequency it is actually occurring, that is different. So using frequency domain filtering, you can actually separate one portion from the another. Okay, that is one way. Also, there are wavelet decomposition. Okay, there is also wavelet decomposition. If I can cover it, I'll try to cover it in the next class also. So you can actually identify the scale. So this is faster, but the scale is small. The fetus's scale, that means the amplitude, is comparatively small compared to mother. So these things you can find from the wavelet transform, then you can actually differentiate. Okay, so this is a like a major issue in terms of taking care of the fetus. You have to identify this ECG. So this is one particular problem. Acha. Any question so far? Any question?
No, sir.
Acha. I'm going a little bit faster because these topics are like enough for it. Acha. Now let's look at the abnormalities. Okay, there are many different abnormalities. Let's talk about some of them. Okay. I'll provide you a link. I'll provide you a link of different abnormalities that can be found from the ECG. Try to study this one. I will discuss the major ones. Okay. Achha. Now let's see the first one. So this is called atrial fibrillation. In short, AF. Atrial fibrillation. Now, atrial fibrillation, this is actually a very common type of arrhythmia. What is arrhythmia? Arrhythmia means irregular rhythm, irregular heart rate or rhythm. Okay. Irregular heartbeat ke bola hoy arrhythmia, and atrial fibrillation is one type of very common type of arrhythmia. Okay. Now, this one is not very dangerous, Ventricular fibrillation, that is very dangerous. We'll talk a little bit later, but atrial fibrillation is not very dangerous. So what happens in atrial fibrillation? How do you find it? You will see the P wave is very small. I'm going to show you a little bit later. The P wave is very small or absent. You can barely see. Okay, so that you can barely find the P wave. So that is how you identify. So if you perform some signal processing techniques, if you cannot find the P wave, so that is correspond to this kind of atrial fibrillation. So the P wave is very small and absent, and the baseline is very irregular, at an irregular baseline. Okay. Also, the QRS is normal. QRS will be normal, but a little bit irregular. In a standard process, these things should be normal, but also regular interval should be there, but QRS will be a little bit irregular. Okay. And the BPM will vary. It can vary from 75 to 190, things like that. So let me show you. Atrial fibrillation. No. This one. Okay. Can you see the screen?
Yes, sir.
আচ্ছা, so this is এটা কি ছিল fibrillation. এটাই। আচ্ছা, if you look at this one, you see what happens in your PQRS before Q, the P should be very clear, but you can see you can barely find the PF here. So that's why I wrote the PF is barely visible or it is almost missing. Okay, that's why you have this one. That is one thing. And the baseline is not fixed. So when you have a normal ECG, the baseline is actually fixed in POF, but you can see as the POF is missing, you can barely find the baseline here. And also the QRS is very irregular. Okay, you can see the distance between different R value, that is I mentioned, you measure the distance between R, that is the rhythm, and the distance between different R is different. So you have abnormal heart rhythm. Okay, so that's when you can understand there is some atrial fibrillation is here. Okay, any question? So let's come back. Okay, so there are many reasons why it can actually happen. Usually the cause of this kind of thing, some underlying disease are there. This is like a precursor to some major complex, major scenario. Because your heart is still functioning, heart is clearly functioning because you have the PQRS segments more or less. So heart is still functioning more or less properly. So this is before some serious issue. So underlying disease, it can be one thing is pneumonia, sepsis, also some cardiovascular disease, okay, ischemia. The problem with this one, it actually increases the risk of stroke. The risk of stroke. You can read these things from the book. I'm just mentioning things. Achha. Now, why this is actually happening? What does it mean by that you cannot find the POF? Etar maneta ki actually? We are interested in this portion. What does it mean? PF is not firing properly. POF টা আসতেছে না, তার মানে কি কোথায় সমস্যা? কোথায় সমস্যা? The problem is in the pacemakers, the natural pacemakers. Okay, heart's natural pacemakers. So that's some issue is there. Okay, the pacemakers is not functioning properly. Okay, that's why you have some abnormal firing of pulses. So sometimes you have the PUF, sometimes PUF is almost gone. So these things relates to some abnormal firing of the pulse. Okay, and especially the sinoatrial node, SA node, the natural pacemaker, that is not actually functioning properly. Okay, that's why you don't have very regular rhythm. Natural functioning, so no regular rhythm. So cannot control the regular rhythm. So this is one issue. Okay, and this is so this is your atrial fibrillation, and these are how you actually can identify from the ECG what is how we can actually determine the atrial fibrillation from the ECG. Okay, and these are the reasons for that one. Now let's move on to the next one, that is ventricular fibrillation. Ventricular fibrillation, VF. Okay. This is more serious. Okay. This is very serious. This is very serious condition. Acha. So what happens in ventricular fibrillation? There is a very irregular QRS. Very irregular QRS. And it happens due to some chaotic ventricular depolarization. Okay. So irregular QRS. So QRS means in the ventricle. P wave means in the atrium. Okay. So when you have irregular QRS, that means something wrong with the ventricle. So what does the ventricular does? What does ventricular does? You got it?
Pump blood out the
Pump
body.
blood. So pump blood out of the body or to the lung. So when these things becomes chaotic, when there is something wrong with it, if this one becomes irregular, what will be happening? You cannot refine the blood or you cannot pump the blood. So when this is irregular, improper pumping of blood. So your blood is no longer pumping properly. So when these things happen, like the pumping is not properly, if or blood cannot pump to the outside of the body properly, what will happen? Immediate seizure, immediate loss of consciousness. Okay, within a few moments you will lose your consciousness. Okay, and if it's not like directly, and some measure is not taken directly immediately, promptly, so you will have death. Okay, within minutes, because your body needs to pump the blood at a certain speed regularly, continuously. If it doesn't, the muscle cell will die. Okay, so muscle cell will die. So you have to do it immediately, like this way, and you have to take some measure immediately to actually get rid of this one. So ventricular fibrillation is much more critical. Okay, extremely critical, and this is like you have to take some immediate measure. Okay. Achha. So what kind of immediate measure that you take? Like you have to give CPR, okay, or external defibrillator. Okay, so that you can get back the normal rhythm. Okay. Achha. Did you guys see Casino Royale? Casino Royale, James Bond. So in Casino Royale movie, there is a scene where James Bond, okay, যখন বিষ দেওয়া হয়, so he actually loses consciousness. He starts to lose consciousness, and he uses external defibrillator, okay, to pump the blood in the right moment. Achha, so there is a scene that's related to this one. So this is your ventricular fibrillation. Achha. This can happen from some drug toxicity or cardiovascular disease. So number 3. So let's look at another one. Ventricular block. Okay. So another type of problem is some blockage in the system. Okay, this is called atrioventricular block or AV. Okay, so you see the conduction happens like this from SA node to AV node, from the AV node to his bundle. From the his bundle, it goes to bundle branches. Now, if there is any abnormality in the conduction, this is the conduction of the electrical signal. In the conduction abnormality, okay, that can actually cause some issues. Those issues are some kind of atrioventricular blocks. Okay, so how do you find this kind of abnormalities? So let's see. It can be divided into different types. One is like first degree AV block, first degree block. First degree heart block. Okay. What happens in first degree heart block? You see, the PR interval becomes greater than 0.2 second. The ideal value should be less than 0.2 second, the PR interval. It is around 120 millisecond to 160 millisecond, but it should be less than 0.2 second. If it is higher than that, that means you have first degree heart block. Okay. So this is not very serious. This is not a serious issue, not serious. Okay. And so all waves are there. Yes, all waves are present. Just the PR interval is taking longer. That means it is taking PR interval is longer, like time for depolarization is taking too long. It is taking too long. Okay, too much time. So that is refers to as first degree heart block. Okay, and so that means you have large pause between P and QRS. Okay, let me show you the image. Okay, first degree AV block, this one. Okay, দেখা যাচ্ছে?
Yes, sir.
Okay, so you can see this is your P. Okay, after this PQRST, this is your P, this is your P. After this P to Q, it is taking too long. It should not be that long. It should be much smaller. So in your time domain analysis, you can measure this interval. And if you find, so if you find that there is a large distance between from this P to the Q wave, then this segment is longer, you can actually identify it as first degree heart block. Okay, so if I give you some images like this, and you have to determine from the images what kind of issue there is, okay, and how to take different measures. So you can find this kind of question in your final. আচ্ছা, this is one. Another one, আরেকটা কি দেখলাম? আচ্ছা, ventricular fibrillation, একটু আগে যেটা বললাম. So in ventricular fibrillation, what was happening? Chaotic rhythm. Okay, you can see this is the normal rhythm and it is very chaotic. It becomes very chaotic. This is your ventricular fibrillation. So you see sometimes the patient is dying before they give the shock. Okay, বুকের মধ্যে যে শকটা দেয় তখন ইসিজিতে ব্যাকগ্রাউন্ডে ইসিজিতে দেখবা যে এরকম দেখাচ্ছে। ওকে, ভেরি chaotic rhythm. So this is your first degree AV block. Then you have second degree AV block. This is your second degree. আচ্ছা, so before I'm discussing second degree a little bit later. So in second degree, it can be divided into different types. আচ্ছা, আমি আগে বলি কিতাব সুবিধা হবে। So that is your first degree. Then you have second degree block. So in second degree block, you have the QRS is sometimes missing. The QRS is sometimes missing. It is not there. Okay. So this can be divided into three different types of second degree. One is Mobitz type 1, Mobitz type 2, and number three types of 3:1 or 2:1 conduction. Three different types. So let's see one by one. Now, Mobitz type 2, this one common. এটা হচ্ছে constant. You have a constant PR interval, but sometimes QRS missing. Okay, so the PR interval is normal. It is type 2. PR interval is normal, but QRS is sometimes missing. Okay, that's your Mobitz type 2. And what is Mobitz type 1? Type 1 হচ্ছে, you see, you have a lengthy PR interval. This is followed by This is followed by a missing QRS. This is followed by a short PR. Then you have normal, a normal PR. And this entire cycle repeats. This cycle repeats. So first you have a lengthy PR interval, then you have a missing QRS, then short PR, then normal. So this is called the Mobius type 1. Okay, this is one type of heart block, second degree heart block. And the third one is 2:1 or 3:1 conduction. It means 2:1 means you have one QRS missing and one normal. Okay. 3:1 means two QRS missing and one normal. So that is actually the 3:1 conduction. It has two missing, one normal. Okay. So if you look at this one, দেখা যাচ্ছে? Can you see the screen? So you see here the Mobius type 1. আচ্ছা, Mobius type 2 যেটা প্রথমে বললাম, the PR interval is normal, but sometimes you have only one QRS missing. So that's your Mobius type 2. What is in Mobius type 1? First you have a lengthy PR. এখানে ভালো মতো বোঝা যাচ্ছে না। So এটা দেখা যায়। So you have a lengthy PR compared to this one. Okay, this is like normal PR. This is compared to this one. This is lengthy. So first you have a lengthy PR interval, then you have a QRS missing, then you have short. যদি তার একটু বড় করতাম তাহলে দেখা দিত। So then you have a short PR like this way. So this is your Mobius type 1 and 2:1 block. একটা মিসিং একটা থাকবে। So one missing, one. একটা মিসিং একটা QRS, একটা মিসিং একটা QRS like this way. This is 2:1 block. Okay, or 2:1 conduction. In 3:1, দুইটা মিসিং থাকবে like this way. This is how we actually determine. And আচ্ছা, let's see. আর একটা বলি। So followed by this one, there is third degree block. So you have first degree block, second degree block, then you have third degree block. What happens in third degree block? You have P wave normal, but after this P wave, no signal is passed. No signal is passed to ventricle. Okay. So the P wave, that means the SA node, that is actually functioning properly. The natural pacemaker, that is functioning properly, but that signal is not passing to the ventricle. Okay. But the ventricle still gets excited. Ventricle excited through internal pacemaker, through its internal pacemaker. Okay. So when this happens, this is not the natural rhythm. So there will be some variation. Okay. Variation in PR interval. Variation in PR interval, variation in QRS complex, because this is not the natural way. Okay. Achha. So, and you will not find relation, no relation between P and QRS, because these are completely different. P is from your natural pacemaker, QRS is coming from another type of pacemaker. So, okay, the internal pacemaker of the ventricles that normally doesn't work. So that is your heart block type 3. This kind of block happens when your blood cannot flow properly due to some blocks. So these are another type of third degree blocks. Okay. So there are more. Number 4, there is left bundle branch block, right bundle branch block. So there are many different types. So you can look into it. Okay. I will provide you the link. You can look into it. And so the last one. The last one is MI, or myocardial infarction. Myocardial infarction, or also known as the আচ্ছা, So myocardial infarction, this is like a severe types of things, the severe types of abnormality when your artery, the coronary artery is completely occluded. Okay, so if the artery is occluded, oxygen cannot pass. Okay, oxygen cannot transport properly. So when oxygen cannot transport properly, your cells will die. The cells will die. Now, if the heart cell die, will they able to regenerate? Regenerate করতে পারবে? পারবে না। The heart cells cannot regenerate. Okay, so the heart cells died, and these things actually continuously, when these things happen, gradually the impulses will be decreased gradually, it will decrease. Okay, and ultimately you will have a failure. So these things like are continuously happening one by one. So you have to have like, it will follow by some issues, like for instance you have some chest pain or palpitation, things like happening before a heart failure or heart attack is actually happening. So this happens sequentially. First, your oxygen is unable to transport, so some cells will start to die. When you have, as a result of this, there will be some symptoms, and finally you have the heart attack. Okay, so these things, the identify of this one, this is identify most ST elevation. There are many things that this is most critical. ST elevation is like, so let me show you. Okay. Am I this one? Can you see the screen? স্ক্রিনটা দেখা যাচ্ছে?
Yes,
আচ্ছা,
sir.
Yes.
you see the normal PQRST, this is like it should go down. Okay, but ST elevation means it does not go down. Okay, before it can go down, you have the ST elevation. This is called the ST elevation. Okay, there can be different types. So this is one. So this is the normal one. These are the abnormal ones. Okay, so this kind of ST elevation, that is how you actually recognize you have some myocardial infarction or things like that. Okay, so these are different types of problems, issues with different abnormalities, and you can find those things from the ECG. You can determine those things from the ECG. Okay. Any questions so far?
No, sir.
So I will provide you a link. So there will be like I can provide you a like broad question from this kind of things, like what are the abnormalities and how can actually determine the abnormalities. I can also give you some images and try to ask you to identify what is the type of abnormality that is present in the ECG. Okay, so that kind of questions will be there. Okay, so I have like discussed কতটা 5-6টা discuss করছি. I have discussed 5 or 6. There are some other abnormalities very common. For instance, atrial flutter. Okay, so this happens, that is like greater than 220. Okay, greater than 220. So the heart is actually beating very fast. Okay, so when the heart is beating too fast, the T and P, the distance vanishes. So there can be some other issues, other types. I'll provide you a link, try to study some a little bit more. Okay, around 10. At least try to study around 10. So that will be enough for this one. Any question? So today, okay, so today we discussed we started from the basic.
স্যার হার্টের ফাংশনালিটি গুলো ভালো মতো পড়া লাগবে স্যার।
The basic
ওগুলোকে exam
functionality, এই যে কিভাবে যে আমার হার্টটা কাজ করতেছে from the start to the end, what is happening and why it is happening, the basic functionality, এই জিনিসটা তোমাকে বুঝতে হবে। and এইভাবে যেমন আমি যে সিরিয়ালে লিখলাম, এইভাবে সিরিয়ালে লিখে দিলেই হবে। ঠিক আছে?
ওকে স্যার।
Achha. So first we discussed some of the common heart functionality, the summary. Then we saw the ECG, then different segments of the ECG. So the characteristics of the ECG signals. So AV segment, ST segment, things like that, R segment. And then how to actually process those things. There are different types of analysis. In the next class, I will try to show you some case studies. Like if you have atrial fibrillation, okay, how can you determine it? How can I actually do it exactly? I will try to show you those things in the next class, inshallah. So then you have this type of analysis. and some abnormal. Okay. So this is for you today. You can write your student ID.
স্যার এই নোটটা একটু আপলোড করে দিন স্যার।
আচ্ছা।
আসসালামু আলাইকুম।
ওয়ালাইকুম আসসালাম।